Greetings again. This is Professor Edwards. We're now going to discuss the future thinking for future of healthcare administration cultural competency to finalize our course for the semester. Why is inclusive excellence matters? Healthcare and medical education face persistent inequities as well as inequalities. This is something that is ongoing. Inclusion enhances innovation, trust, and patient outcomes. Diversity in education produces culturally competent providers as well. The HHMI capstone institutions have provided us with some core lessons. First and foremost, if we embed equity in institutional mission and leadership, it's always successful and helps. It also helps to support faculty to implement inclusive pedagogy. This deals with all types of organizations of education and learning. Create identity affirming environments for all learners, no matter their race, background, sex, orientation, creed, it doesn't matter. And then sustaining efforts through data, through funding and accountability. These are things that we can always implement to move us forward in the direction of healthy healthcare administration cultural competency. Cultural competence in healthcare helps us to recognize and respect patient backgrounds and needs. This includes our future patients. It also helps to train providers in cross-cultural communication, address social determinants of healthcare and delivery as well. So it helps us to gain better access. There are certain strategies that are inclusive for healthcare education as well. It helps to integrate DEI across the curriculum, not just in one course, and also helps to foster mentoring and belonging for students of color. We also can use case-based learning that reflects diverse populations and aligns institutional policies with equity goals. When it comes to our practice and alignment, we should link training to hiring and promotion practices. This is for people who are diverse in background. Involve communities in feedback and decision making, communities that usually are not seated at the table. Use a sense of metrics to track inclusive outcomes as well, because data always matters. And then we need to reward inclusive teaching and leadership to help reiterate the positive behavior. Finally, we have our call to action. Commitment to lifelong learning and cultural competence is very, very, very needed. I can't stress it enough. Without the commitment to lifelong learning and always evolving as a learner, cultural competence soon fades away because the world is always changing. We must also invest in equity infrastructure and training because without the investment, there is no real growth. And then we must ensure inclusive excellence is mission critical because we know as organizations go on, especially as administrators, we often have to reiterate our mission and our purpose because when things align with our mission and our purpose, we can further achieve our goals, especially within healthcare administration cultural competence. And then we must transform education to transform healthcare because without the transformation of education, we cannot transfer our competencies in this cultural competence space. Thank you so much. If you have any questions, please feel free to ask them at this time.